And welcome to another Video3 Media Newsline. Joining us today is Andrew Strong, Assistant Director for Policy and Communication at the Alliance Scotland, Lindsay Allen, Executive Director for the Scottish Cot Deaf Trust, and Manira Ahmed, Head of Service at the Local Intelligence Support Team for National Services Scotland. But first, let's have a look at what we've been up to this month. The Cluster Quality Lead National Networking event on the 23rd of February at the Crowne Plaza, Glasgow. Keynote speakers included Deputy Chief Medical Officer Dr Gregor Smith, the Scottish Government's Deputy Director for Primary Care Richard Foggo, with Healthcare Improvement Scotland's Medical Director Dr Brian Robson leading the way, with a very entertaining and informative discussion on what support could look like. All material from the day's event will be available from our Health and Social Care YouTube channel in the coming weeks. The Scottish Government and NHS Scotland held a one-day conference on the 14th of February at the Edinburgh Conference Centre at Heriot-Watt University. The Modern Outpatient, a Collaborative Approach programme, included Chief Medical Officer Dr Catherine Calderwood and Chief Nursing Officer Fiona McQueen. With workshops running throughout the day, there was plenty being discussed. You can check it out for yourself from the Health and Social Care YouTube channel shortly. As part of our growing commitment to the third sector, we attended the annual Gathering exhibition at the SEC in Glasgow on the 22nd and 23rd of February. Over 1,000 attendees and exhibitors came and went over the 2 days, with several organisations sharing great ideas for new video content. Watch this space. The Alliance does amazing work for people who are disabled or living with long-term conditions, and for unpaid carers. We're joined now by Andrew Strong, Assistant Director for Policy and Communication. Andrew, thanks for joining us. So, can you talk about the value of human rights-based approaches to health and social care? And what do you mean by transformational change?
Well, human rights are quite often associated with the courts in this country. We often talk about human rights when we talk about the rights of prisoners, for example, and things like that. But actually, human rights provide us with the really basic ingredients to design and deliver services. For example, in health and social care, we really need to look at the principles of human rights and how they can actually improve what we already deliver. From our perspective, there are a number of ways that we can do that. We espouse a model called the panel principles, which is about participation of people who use support and services, the accountability of the delivery agent of those support and services, non-discrimination and equality underpinning the role of those services, empowerment of the people who are using those services to complain and give feedback and make sure that their views are properly heard and that they can co-design what happens next, but also the legality element of that, so that doesn't go missing, but actually we can use these principles to design and deliver better services in the future. In terms of transformational change, what we see in the health service just now is a continuation of where we've come from since the health service was set up. But actually there are opportunities to do things slightly differently now. We have a new delivery plan for health and social care in Scotland. What we would like to see is things pushed a bit further for more involvement of people who use support and services in the design and delivery of their care. Things like self-management really coming through a lot more strongly in what's happening. Co-production being an opportunity for people to give their views on what their services should look like, to design those services and make sure that their views are adequately heard and acted upon. And that's quite a challenging thing for the health service to do, but actually one which will really give us a lot of value in the future, I believe.
So, with the upcoming council elections, what impact do things like social care have on people with long-term conditions?
I think it goes back to the human rights issue. Social care is a massively important, has a massively important role in supporting people to achieve their human rights. Social care can mean anything. It can mean supporting people to get out and about and enjoy friendships, right to supporting people to get up in the morning and things like that. But the thing to remember about social care is that we're not doing people a favour when we deliver those types of services. They're actually about supporting people to achieve their human rights. And the council elections offer us an opportunity to look again at social care. A lot of people talk about a crisis in social care. And the integration of health and social care is supposed to really think about how we can deliver support and services in the community. And the councils and the health and social care partnerships have a massive role to play in delivering that. We've just done some research into self-directed support, which is an element of the social care landscape. It's there to help people to direct their own support, to put in place the types of support that they need, and to use budgets from the council to make sure that that happens. What we're finding though is that our members tell us of a different experience, and that experience being of long waits to achieve a self-directed support budget, that actually the choices that they can make are limited, and that actually the social work departments don't necessarily understand all of the options and all of the choices they can make. And some things need to be done about that. Some things can be done at a national level, and some things can be done at a local level, and we'll be expecting the new set of councillors to really be on top of that and making sure that self-directed support happens in the way that it was previously espoused.
So what sort of changes are we seeing in the models of primary care?
I think we're seeing quite an interesting time in terms of primary care. We're on the verge of a new GP contract, but actually we're looking at really innovative ways of thinking about the future. The Alliance's work has encompassed a number of different new models of primary care being developed. For example, we have the National Links Worker Programme, which is running through the Alliance, and that's 7 community links practitioners in 7 GP practices in some of the most deprived areas of Scotland. And they're there predominantly to support people to access community assets in their local community, which they might not know about. So going along to your GP has traditionally been, I've got this problem, how do I solve it? Now, the community links practitioner can speak to people about things which are not necessarily considered traditionally medical issues, but they can talk to them about things like money issues or friendships and loneliness and things like that. And they can say, here's things in your local community that you might want to access. So there might be a local community group that you'll be able to access. There might be a support and service that you might be able to access. There might be friendship groups. So that person can be there as the link into that. Now that's an innovative model. It's been taken forward and in a number of different ways in a number of different parts of the country. And the Scottish Government has given a commitment that in the next 5 years, 250 links practitioners will be available across the country. We have a particular model that we think works, and one which we'll be saying actually that has a role to play, and it'll be interesting times to see how that innovative role is taken forward. At the Alliance, we also have a programme called the House of Care, which is working in a number of areas of Scotland to co-design services with health professionals, including GPs, and that's really looking at all of the elements that are needed to help support people to co-design the type of support and services that they need from the health service. That's a really innovative project, one that's in development and one which will, over the next few years, be rolled out, I'm sure, and real opportunities through that to improve the experiences of people who use support and services.
And what would you say is the role of digital in supporting transformational change?
Yes, again, this is something which we have a couple of projects working on. I think digital has a massive opportunity for us. It presents opportunities for people who use support and services to really, again, co-design and co-produce the types of services that we want to see in the future. Some examples of that, the Alliance has the ALICE programme, which is an online index, open source for anyone to use, which is a collection of community assets, of things which are in the local community or at a national level that people can access that maybe are less findable. But actually, if you put them on an online resource, people can put their postcode in, they can say something like mental health, and they'll know exactly the type of resources that are available to support them. And that, as an open source index, is also available for people to put up their own examples of community assets. Now that's a really innovative tool. It's available, as I say, for anyone to use it, not just for people who are trying to access it, but for people who are in the position, say, of a GP or a health professional, where they're looking at what actually help this person to live better? What can help this person to stay well? One other example that we're looking at just now is through the RGP project, which over the last few months has been out and about across Scotland asking people what digital technology can do to improve their experience of going to the GP. Now, they've recently come up with 3 different new innovative ideas which they're asking people for their views on. One of those is a personal profile where people will be able to share non-medical information about their life with their GP, so that can inform their future consultations with the GP. Secondly, there's an app which is looking at images of skin conditions, so minor skin conditions which you can send to a clinician and they can tell you what steps you need to take next. And finally, we're also looking at consultations and how people can maybe replay a consultation that they get with a GP. They have digital access to keep on repeating it so that they can remember what they've been told, how they can self-manage, etc. So those are the sort of opportunities that we're looking at around digital, and there are many, many other opportunities. But I think in terms of where we are with digital technology and the future, there are many opportunities where we could really be capitalising on and making people's lives better as a result.
And finally, Andrew, can you talk about self-management and supporting people with long-term conditions?
Yeah, self-management has been a long-running concern that the Alliance has had. We've from our early days, and we were formed in 2006, and one of the original messages that we had was about self-management really being able to support people to live better. In 2009, we worked with the Scottish Government on a self-management strategy for Scotland, which said that self-management wasn't about going alone. It was about being informed by professionals and being able to make judgments and decisions in conjunction with professionals about the type of support and services that you might need in order to live well. Subsequently, we've managed the Self-Management Fund for Scotland, and that over the last 8 or 9 years has supported 244 innovative ideas coming from largely the third sector to take forward self-management programmes in Scotland, and that's supported a whole range of people living with long-term conditions. It's really looked at what does self-management mean in people's lives, how can people go about supporting themselves, how can health professionals support that, what's that mean for the future. We've also set up a network in Scotland of people who are interested in self-management, and that's involved health professionals, it's involved people with long-term conditions and others, and trying to come together to talk about how do we make sure that self-management is on the agenda of all health professionals, that it's a massive part of the future. I think one thing that we're quite pleased about is that actually some of the strategies coming from Scottish Government really mention self-management and really see it as an integral part of how we achieve the shift in the balance of care. But what we need to see more of is this put into a practical setting of health professionals talking about self-management and using self-management and supporting people to self-manage their long-term conditions. So I think it offers us opportunities again, and we're really looking to the future and how that can support the change.
Andrew Strong, thank you very much. The Scottish Cot Deaf Trust is the only cot deaf charity in Scotland. For the last 32 years, they have been tirelessly raising funds for research, educating the public and healthcare professionals, and supporting bereaved family members. We spoke with their Executive Director, Lindsay Allen, to find out more about their amazing work.
The Scottish Cot Deaf Trust was formed in 1985, so we're over 30 years old. We're Scotland's only charity dedicated to sudden unexpected death in infancy, sometimes called SUDI, and cot death is the very traditional term for that, when a baby dies suddenly and unexpectedly. The charity is based in Glasgow, but we do cover the whole of Scotland. A large part of the work we do, we support families who've been bereaved by the sudden unexpected death of their child. Now, the name might lead you to believe it is only very young babies, and it's only babies that have died in cots. It's not. The charity supports families who've lost a baby or a young child up to preschool age, when that death has been sudden and unexpected. So we support parents of those children, we support other family members who've been affected by the death, including siblings. We also support professionals. If you can imagine a GP or a health visitor that's been practicing for 20, 30 years, and this is the first time that they're supporting a family, quite often those professionals need quite a bit of guidance and support in how they can help the family as best they can. And they themselves are very often quite badly affected by the death of this child, so we support professionals as well. The charity has three main aims, and I think something that I'm proud of is the fact these aims haven't changed since the charity was first founded. Now, of course, we support families and people affected by the sudden death of a baby. We also provide education, which is free to any professional, to parents, to the general public. And the education is really around the ways that cot death can be reduced. There are some risks that we know increase a baby's chance of dying from cot death. And our messages are, if there's anything we can do to reduce these risks, we need to share those as widely as we can. There's some very simple measures that people can take around making sure babies sleep in a safe environment. There's key things about position that babies are in. I don't know if you're aware of the Back to Sleep campaign from the early 90s. That was a very powerful public health message that really got out into the public domain, and that's been responsible for a huge reduction of cot deaths, about 70% reduction in cot deaths, not just in Scotland and the UK but worldwide. But we've stubbornly stuck with the plateau of this other 30%. And what we believe is that the position babies sleep in, the environment they sleep in, so making sure that they're sleeping on a firm, flat surface, that there's not too much bedding, the babies aren't too warm, that they're sleeping in their own safe environment. These things can all contribute hugely to reducing a baby's risk. Another main factor is whether parents are smoking, whether there's members of the household smoking, whether mum has smoked during pregnancy, because these babies will be more vulnerable. So again, it's about sharing the messages that smoking plays a big factor in the number of babies that die from cot death. And I think as well things like promoting breastfeeding. We know that that's protective, so if babies can be breastfed, we can't say it will reduce every risk, we know it will reduce the risk a little bit, and that goes some way towards it. The difference, I think, with the Scottish Cot Death Trust is this is what we are dedicated to doing. We are solely focused on sudden and unexpected deaths, and anyone who works with this organisation or on behalf of this organisation. So we employ services of regional support workers. We might refer families for specific counselling if there's certain issues that they're really struggling with in their bereavement. We would look to get some psychotherapy to help them through that, to help their recovery. It might be that siblings are needing some play therapy if they've been really traumatised by what happened when their baby brother or sister was found. Anyone working for us has had training to understand the whole medical legal process that has to happen after a sudden unexpected death in infancy. And part of what we do is constantly trying to educate people that the police have to be involved and will be involved in every single case. There will be a full investigation, there has to be a post-mortem. But parents are very distressed if they're constantly having to explain that to people and almost having to explain why that has happened to them. And it's not them individually, it happens to every single family when there is a sudden unexpected death. So anyone that works for us has a complete understanding of that process, and that, I think, makes us different from when families perhaps engage with generic bereavement services and find that it really hasn't met their needs, because there's that lack of understanding about the Scottish legal process. We rely very heavily on public donations. A lot of the donations that we receive are from families who are doing fundraising events in memory of their child who's died. And that, I guess, to a lot of people would make sense. It's people that we have supported that then support us. But we do rely on charitable funding from other trusts and organisations. We do get some funding from Scottish Government, but it is minimal, and year on year that funding is being cut. So we rely on around 89% of our funding from public donations, and that's getting harder and harder to come by. But we strive to keep the same services. We have never cut the services that we provide to families. And indeed, to date, we've funded around 3.2 million on research into the causes. So I think, as a very small organisation, we're quite proud of what we can achieve. But it's challenging, and it's challenging every day to be constantly seeking funding to continue our work. I think most people would be very surprised to learn that we're such a small organisation. We have 2 full-time members of staff and 3 part-time members of staff. We're based in one office within Glasgow, but we do cover the whole of Scotland, and for us it doesn't matter where a family live, it doesn't matter where a group of professionals that need education are, we provide that service, whether they are in the north of the Highlands, whether they're in Dumfries and Galloway. Everybody is offered the same service, free of charge, from this organisation. We last year had around 107 referrals into the organisation. We were able to provide a bespoke service to any family member. And I think that's a strength of this organisation, that we can very much provide what an individual needs. We're not having to be too prescriptive. We delivered education to around 2,500 professionals across Scotland, whether they were midwives, health visitors, police. And again, I don't think people often realise the impact and reach that this charity has. I think we do punch well above our weight.
In this day and age, we all appreciate the importance of data and information, no more so than National Services Scotland. To find out how this data and information can be used to improve the lives of service users, I went along to National Services Scotland and spoke to Munira Ahmed, Head of Service for the Local Intelligence Support Team. So thank you for joining us, Munira. Can you tell us a bit more about the purpose of the Information Services Division?
So the purposes of the Information Services Division is allow access to information which is available not only locally but nationally, develop tools and techniques which allows the user to very easily look at data that suits their service area. And it also allows individuals to look forward, so not only looking at the past of what's happened and what we've done, what we're doing now, but actually look forward to what could potentially happen if services run in certain manners. We have done this for over 50 plus years, so you can imagine we have a wealth of data around the health arena, but only over the last few years have we really taken stock and understood the importance of social care. And actually, to really support health and well-being, we need to marry both the health and social care data together. So, as I say, the last couple of years has been a real new venture for us to be out within the health and social care arena. We've been using the expertise that we built up through analysts, information manager, and plethora of other skill types that we have to deploy that locally. So, understanding what the data has told us historically, understanding and using algorithms to look forward into the future if we continue deploying services at the rate we are, what that would do to the health service and the social care service, then using that operationally to see what does that really mean to the end user, the service user, that inevitably will benefit for the health and the well-being that's being served operationally.
So what do we mean by local intelligence?
So local intelligence is all about bringing data and information out locally to individuals that work in the front line. But rather than me going in and explain too much about it, what I'd like to do is show you a video that takes you through the journey of local intelligence and our reach.
We understand the challenges that are being faced every day by you in gaining insight into your local services and community. With increased joint working across health, local authorities, third sector and community planning partnerships, we know there is a need for better joined up data to support decisions that are right for your community. You can access data about acute care through our Discovery product. Analysis on social care data and costing information is available through the Source Toolkit. Work is well underway in enabling better access to GP data too through Spire. We aim to provide a single access platform to these products to make it easier for you to get the information you need to answer your questions. We provide a network of locally based analysts and information management specialists who work closely with you to provide insight on local priorities. We link in with our colleagues nationally to ensure you can fully harness the information that is available. All of this information and support can really help you to improve your integrated service delivery to improve the health and well-being of your community.
So as you've seen in that video, our reach is expanding. So in 2015, we started working with the Health and Social Care Partnerships. And what we quickly realised was all the other plethora of organisations such as the voluntary sector, the local authority that sat around that arena that were also delivering levels of care to the community and the service users. So very quickly, we started to work and bring in data and information from organisations that we hadn't touched before, which has now led us to the current day where actually we're increasing our reach into the primary care field, into GP practices, and aligning our data and information to the GP clusters, which officially launches 1st of April 2017.
So what are the different types of approaches we are taking with data and information?
So there's been a wide range of approaches that we've been taking with the data and information. From one place, we've been linking data from different sources and actually been able to map from the birth to the death of an individual, the whole journey, how the individual touches health, social care, the voluntary sector, the private, the third sector. And that suddenly starts to paint a picture as to how information can then influence where we go from there. We've been able to open the eyes for some professionals on the front line to actually see the journey of the individual from the start to the end point. We're also bringing people along with us on the journey by co-creating what data should be telling us. So there's a piece around developing new platforms to support what's best for Scotland. So rather than doing little wee programmes of work and duplicating that effort across Scotland, what can we do to support and minimise that? And what we've done is we've developed a number of platforms to support the data and information that is out there. One of them is known as Source, which is the Health and Social Care platform. We're also developing our Spire platform, which will be there to support the GP practices and more so the clusters and understanding the data available within that sector.
So how is local intelligence expanding across Scotland?
Local intelligence is at a really exciting time. So this year for us, we will be venturing into the GP clusters. Very, very new for us in a territory which we haven't been in since the last 17 years. But what's more exciting is that all the information that we've harnessed over health and social care, we're now going to be able to link that with primary care. So for us, that's going to make us understand the true journey of individuals. How can we really shift that balance of care? And how can we empower professionals from GPs to link workers, to practice managers, to care workers, social workers? How can we empower those individuals knowing what information is telling us, so each contact they're having with the service user is the one that is needed for that service user, is beneficial for that service user, and really supports the wider agenda of individuals living healthier, longer lives in a homely setting.
So finally, what is the vision of local intelligence for the future?
So for that, the world's our oyster, if I could say that. But for predominantly right now, for us, the focus is for Scotland. How can we help all the individuals the way they need the help under health and wellbeing? Now, I've touched on a few areas that we've done and now we're expanding into, but there's much more out there. There's much more out there that we're still to look into and understand. But the key piece that runs through all of this will be the information and the data that comes with it. So for us, it's now to understand where else do we need to be, so where else do we need to get data and information from? What other institutions and organisations which we haven't been collaborating with need to be part of that co-production? And the other piece for us is supporting communities understand the data we're producing. So data is only as good as what or how people read it and how it's used. So the big focus for us over the next few years will be to support communities and support professionals to be able to read and understand the data, and importantly, do something meaningful from it. So actually be able to make a decision or deploy a service that's the right service, but is supporting the health and well-being of those individuals within the community.
Munira, thank you for joining us. Well, that's all we have time for this month. Join us next month for our Dementia Special, where I'll be on location in Kilmarnock at the Dementia Resource Centre, talking with Chief Executive of Alzheimer's Scotland, Henry Simmons. As always, keep an eye on the Video3 Media Health and Social Care YouTube channel for upcoming projects, including 4 new videos for the Scottish Fire and Rescue Service. Like and share this video, and we'll see you next month.